So what about pregnancy? As time is going on, we're finding that there are younger and younger people being diagnosed with type 2 diabetes, and obviously this is now affecting women of childbearing age. So if you do have diabetes and you are thinking about getting pregnant within the next year, it is important to speak to your healthcare professional to get some pre-conception advice, to make sure that you're in the best possible situation for you and your baby when you get pregnant. And essentially, we want to do this because unfortunately, diabetes and having raised blood glucose can have a detrimental effect on your pregnancy and potentially on your growing baby. And so you want to try and minimize those risks as much as possible. And certainly for the 6 months or so running up to becoming pregnant, you would want to be keeping as tight a blood sugar control as you are, maintaining an excellent blood pressure, a normal weight. And also another important thing is to start folic acid. And for most of the population, that's recommended at a dose of 400 micrograms a day. But for those people with diabetes, actually the recommended dose is 5 milligrams a day. And that is going to be something you will need to get on prescription from your doctor. If you do have diabetes and become pregnant, it is even more important for you to maintain very tight blood glucose control, and you will be referred on to a specialist team at the hospital to help you with that. It's very, very important, and you can do that through diet and may also be prescribed medication to help you keep your blood sugar readings as tight as possible. You will also have additional blood tests taken during your pregnancy to check your overall health as well as your kidneys and diabetic control, and you will also have some extra retinal screening as often when the blood sugar change during pregnancy, certainly at the beginning when they're very tight, this can cause sudden changes in the back of your eye, so they would want to monitor those quite closely. You may also need to change some of your medication taken for diabetes or high blood pressure, as all these medications aren't necessarily safe in pregnancy. So again, this is very important, something to talk about to your doctor if you're thinking about becoming pregnant, because they may suggest changes to your medication there and then. And certainly if you find out you're pregnant unexpectedly, you need to get in touch with your healthcare provider so they can advise you on any medication that needs to be changed or stopped. And as I said, folic acid, the 5 milligram dose, which is slightly higher than what's recommended for a woman without diabetes. So that brings us to the end of the introduction to diabetes. I hope that has been useful and has given you a better understanding of what diabetes is, the problems it can cause, and what you can do to best control it and prevent any risk of long-term complications. Please do feel free to sign up to our low carb program, and this, as discussed in diet, can be a really, really powerful and useful way of controlling your blood sugars and preventing long-term complications, and potentially preventing the need for medication if you're able to bring your blood glucose down to normal levels through diet and lifestyle changes. And you can find that advice there on the website given or through that QR code there. So please do get in touch, have a look at our other resources, and hopefully you'll either put your diabetes into remission or be able to maintain excellent control and live a long and healthy life. So thank you very much for listening, and take care. Bye-bye.